We're going to go over chapter 8, which is the blood and lymphatic system. We're going to look at some of the terms, some of the pathophysiology here. Just a little overview. The blood is going to transport oxygen, nutrients, and hormones to the body cells and carry waste and carbon dioxide away. And lymphatic system protects the blood by filtering microorganisms and foreign particles from the lymph, which is a clear fluid collected from body tissues. It also supports activities of lymphocytes and the immune response. So plasma is referred to the liquid portion of the blood. Cellular components in the plasma are going to be erythrocytes, which are red, leukocytes, which are white, and then platelets, which we need for blood clotting factors. Serum is a portion of the plasma that remains after the clotting process. So when we say we're going to do a serum draw, that means we're going to draw blood from that patient. Some components of the blood you can see here. So if you look at a blood in a tube, on the left it's unclotted versus the right is clotted in that tube. And then you'll see the plasma and the serum. So differences there. And then under a microscope, how you might see how they look. Here, white blood cells, which we call leukocytes. Within those, we have granulocytes, which are neutrophils, basophils, eosinophils. So our neutrophils are like our soldier fighting cells against infection. We also have agranulocytes, monocytes, and lymphocytes. Lymphocytes are also very important for fighting bacteria. And then our erythrocytes are red blood cells and platelets. We look at the lymphatic system overview. It protects, again, by the filtering microorganisms and foreign particles, supports the activities of lymphocytes in the immune system, and maintains the body's internal fluid environment between the blood and the capillaries and tissue. And it's responsible for carrying fats away from digestive organs. So this kind of gives you an idea of the lymphatic system here. So you'll see when we have oxygenated versus unoxygenated blood. So the veins and the arteries, the veins pertaining to blue, and then the arteries are the pink side here. So upper right quadrant of the body drains to the right lymphatic duct. The remainder of the body drains in the thoracic duct. The thymus is, which we learned about with the endocrine system, is the primary gland of the lymphatic system. It produces T lymphocytes to help the immune response. And then the spleen also is located, it's large and located between the stomach and diaphragm at the left upper quadrant of your body, and filters out aging blood cells and removes cellular debris. So you can see the little pictures on the bottom of where they're located. Lymph itself is fluid that is circulated through the lymph vessels. Lymph capillaries draw lymph from tissues to the lymph vessels, and then lymph vessels circulate lymph to the lymph nodes. And that picture here kind of shows you all the network of them, and the nodes would be the enlarged areas. The nodes are oval structures that filter a lymph, and they're located throughout the body. Cervical, axilla, and inguinal regions are usually the ones that you can feel, although we have them other places. The ducts are collecting channels that carry lymph from the lymph nodes to the veins. When we look at the immunity, it's the process of disease protection induced by exposure to an antigen. So an antigen is a substance that when it's introduced to the body, causes the body to form antibodies against it. An antibody is produced by the body to destroy or inactivate an antigen. So often when you do we do skin testing, we're seeing how the person's immune system responds to it, and if it's going to protect it, or if they need exposure to an antigen to get that person's body to respond, or does that person's body have the capability? When we look at active immunity, it's what we call long-lasting. It protects the body against a future infection as a result of natural antibodies developed after infection. Kind of what they're trying to do with when you look at being exposed to a virus, does your body build up immunity? So if you're exposed again, you won't contract it. Versus passive immunity is short-lasting, conveyed naturally through the placenta to a fetus, conveyed artificially by injection of an antibody, and artificial antibodies like a vaccine. So when we say we get a flu shot every year, it's passive, it's short-lasting, it's only going to cover for a short time frame, if at all. When we look at immunoglobulins, IGs, they're protein antibodies. They're secreted by the B lymphocytes, and they protect the body from invasion of foreign pathogens. We have 5 major categories: IgA, IgD, IgE, IgG, and IgM. So often somebody that's lacking immunity will have like an IgG infusion to pump up their antibodies. Some of the terms that we're going to see: blasto is a germ or a bud. It could be a suffix as well. And so erythroblastemia or megaloblast, which would refer to like a large germ or bud, or erythroblastemia would be, the erythro would be a red bud in the blood. Chromo or chromato is color, so chromic pertaining to color, or hemochromatosis. So this would be like under a microscope where you're able to see, like this slide here is pictures of color in there. Lympho is the clear fluid, so lymphogenous pertaining to the clear lymphatic fluid. Morpho is to form, morphologic. Phago is to eat or swallow, phagocytosis, so pertaining to eating cells. Cyto meaning cell, cytology, study of cells. Chylo is juice, clythemia, blood, so juice in the blood. Hemohemato is blood, so hemostat is actually an instrument to used in blood or for blood, so often used to stop blood. Hematopoiesis, so this would be pertaining to blood and the reproduction of red blood cells. Immuno is safe, so immunology. The immune system, study of. Myelo is bone marrow or spinal cord, so myelogenous, originating from bone marrow, pertaining to. Plazo is formation, so aplastic, pertaining to no formation, A. Reticulo is a net reticulocyte, so that's the type of blood cell or type of cell. Spleno, referring to the spleen. Splenomegaly, megaly meaning enlarged, so enlarged spleen. Thrombocyte, thrombo is clot, so cyte cell, so there is a presence of a clotted cell. Thymo, thymus gland, thymic, pertaining to. Symptomatic terms that we might see would be microcytosis, micro meaning small. So when we look at the presence of small red blood cells, cytosis, versus macro, which would be the presence of large. And anacytosis would be the presence of red blood cells of unequal size. And is not, and then, or without, and iso is equal, so unequal, pertaining to size. And then poikilocytosis is presence of large irregular shaped red blood cells. Reticulocytosis is increased number of immature erythrocytes in the blood. Erythropenia, abnormally reduced number of red blood cells. Neutropenia is where we have decreased neutrophils. Pancytopenia, pan meaning all, the abnormal reduced number of all the cellular components in the blood. Thrombocytopenia is reduction of the platelets in the blood, so decreased clotting. Hemolysis is breakdown of red blood cell. And then terms related to lymphatic system, immunocompromised is somebody that has impaired immunologic defenses caused usually by some disorder or therapy that's going to reduce their immune response, which is very similar to immunosuppression, where the impaired ability to provide an immune response. So immunocompromised meaning the condition is that you have an immune system that's not going to respond, and suppression is where we're actively suppressing it. Could be from disease itself, but also from meds. Lymphadenopathy. Lymphadenopathy is enlarged lymph nodes, and should be splenomegaly there, should be an L, and that's splenomegaly, enlargement of the spleen. And when we look at some diagnostic terms, AIDS is acquired immunodeficiency syndrome. It's a syndrome caused by the HIV virus that renders immune cells ineffective, and it allows what we call opportunistic infections, infections that are deadly and we don't see a lot, or malignancies to develop because the immune response isn't there. Anemia is a reduced number of red blood cells, so lack of hemoglobin and hematocrit levels go down, and then that person might need a blood transfusion. Autoimmune disease is any disorder that is characterized by abnormal function of the immune system, and it causes the body to produce antibodies against itself, so resulting in some kind of tissue destruction within the body. A lot of diseases are referred to as an autoimmune disease. The HR factor is an antigen on the surface of red blood cells of the Rh blood group system. Its presence can cause a reaction between an Rh positive and Rh negative blood. That's why we have to make sure that if the person has Rh positive, they have presence of antigens, and negative, they do not. So it could result in a blood transfusion reaction if you're not given the right factor. Hemochromatosis is a hereditary disease with excessive buildup of iron deposits in the body. And then hemophilia is a hereditary bleeding disorder, which a person's lacking clotting factors to clot their blood, so they have potential to bleed. Leukemia is cancerous disease of blood-forming organs, characterized by abnormal leukocytes in the blood and bone marrow. Lymphoma is a cancerous disorder of the lymph tissue, and Hodgkin's disease is a common one. We also have lymphomas of non-Hodgkin's disease. Metastasis is where cancer cells have spread by blood or lymphatic system through to distant sites from the origination of where it started. So it could start from, so you have lung cancer and it metastasized to your liver. Mononucleosis is caused by the Epstein-Barr virus and has increase in mononuclear cells in the blood along with enlarged lymph nodes. Person's often tired and has a sore throat. Polycythemia is increased number of erythrocytes and hemoglobin. So the person often presents with a red face. Septicemia, that's also spelled wrong, should be SEPTI, is a systematic disease. Systematic means throughout the body, whether you have bacteria or an infection in your blood. Some of the test or procedures that we see, phlebotomy refers to just an incision into or puncture of a vein to withdraw blood for testing, often called venotomy. Venipuncture is incision or puncture into the vein to withdraw blood for testing. It's just kind of puncturing. Bone marrow biopsy, this is where we're going to actually go into the patient's bone to get down into the marrow and to remove some of that marrow and send it off for a study, which can sometimes result in diagnosis of cancer. So we do a lot for pathological examination of that tissue. And we can do bone marrow aspiration as well. The BMP is a basic metabolic panel. That's where we're looking at blood that is part of the what we call the chemistry. So we would look at the potassium and sodium, and it doesn't quite give us all the electrolytes that we see, which we would see with a CMP, which is a comprehensive metabolic panel. We look at a CBC, it's a complete blood count, and with differential, it's going to break down the lymphocytes and granulocytes instead of just having what they certain, let's say like a lymphocyte, a monocyte. It might not be broken down if it's automatic versus a manual differential. A blood culture would be to remove blood and to culture it to see basically if there's anything growing of a bacterial nature. CD4 cell counts going to give us an idea of that person's immune response. So a measurement of the T lymphocytes in the blood to usually monitor when a person has HIV. What puts them at risk is that number of their cell count. Erythrocyte sedimentation rate is ESR, time test that measures the rate at which red blood cells settle through a volume of plasma. And we might see that increase with the presence of inflammation. A PTT is a partial thromboplastin time. It helps us determine how that person's platelets are clotting. And a PT, which is a prothrombin time, is something that we use also to measure clotting, but we specifically use it to look at therapeutic levels. So if a person's on a medication that causes blood to thin, is it thin too much or not enough? And within that, prothrombin time is what we call an INR, international normalized ratio, and that gives us a normal number for that medication. This shows you the complete blood count, CBC. So in a CBC, we're looking for, at the top, you can see white blood cell, red blood cell, hemoglobin, hematocrit. So that white blood cell will give us the indication if that patient has a normal immune response. It could also be increased or decreased from certain medications and conditions, but we often see it elevated in the presence of infection. If a person's anemic, we look at that hemoglobin, hematocrit, HGB, HCT. That tells us if they've lost blood. Could be from anemia, could be from a blood loss, having their arm cut off and bleeding. And then pretty much the MCVs and MCHs kind of give us the size and the shapes of the red blood cells. And PLT is the platelet, is that person's ability to have their blood clot. And then below that would be what we call the differential part, where it's giving us the lymphocytes and monocytes. And then we can tell if that person's immune system is responsive. The CMP, the comprehensive metabolic panel, versus the BMP, the basic metabolic panel. And so we should have more diagnostic tests in here than just like sodium and potassium. This one will also have like carbon dioxide. AST and ALT are what we call liver function tests. Kind of gives us an idea how that liver is functioning. Like here, the ALT is 8. ALK Phos is normal, so that's good. Amylase will give us an idea of how that pancreas is functioning. And then, let's see, they should have a, well, there's a creatinine is 1.5 that would be indicative of how the kidneys are functioning. And the blood urea nitrogen, a BUN, I'm not seeing it on there, which it should be. This shows a bone marrow biopsy, so can be very painful. They're going to actually core into that bone, and then so they have what's called a Jamshidi needle. It's going to go in there, and basically it's going to aspirate. It's going to take out it in a non-core and needle that in the inside. They're going to dig in there and pull it out, and then there will be somebody from the lab with a petri dish immediately to put it on a slide in a petri dish to send that off to the lab. Person can have a bone marrow transplant, which is the transplantation of healthy bone marrow from a compatible donor. It could even be from themselves, but we have to deplete all their immune system with chemotherapy and then replace with their healthier bone marrow. And we do a lot of stem cell now, so it's not actually bone marrow, it's a stem cell transplant. That's why we have bone marrow drives now. It's people don't have to donate their actual bone marrow, it's blood. Lymphadenectomy is the removal of a lymph node, and lymphadenectomy is incision into a lymph node, which we often do to biopsy in the presence of cancer. A lymph node dissection is removal of possible cancer-carrying lymph nodes, which is a pathological exam. Spleenectomy is removal of the spleen, and thymectomy is removal of the thymus. A blood transfusion, we can give whole blood, we can give packed red blood cells, we can give platelets, we can give what we call fresh frozen plasma, but typically the number one thing we give is packed red blood cells. So if somebody's anemic or lose blood, we do a packed red blood cell transfusion. Chemotherapy is giving systemic, would be IV medication to render cancer non-producing, or to usually it's to destroy the cancer cells at a certain cycle specific part of the cell cycle. And we can also, chemo is also referred to as anti-infective medication as well. Immunotherapy, which a lot of our chemo is biological agents to prevent or treat disease by stimulating that patient's own defense mechanism. So with AIDS, cancer, or autoimmune diseases or allergies. Plasmapheresis is removal of the plasma from the body with separation and extrication of specific elements. And then we put it back in. So apheresis is withdrawal. And so we might, if somebody has a leukemia where they're overproducing white cells, we might do this plasmapheresis to take that plasma out and give it back after we take out white cells. Medications we see, anticoagulants, are going to prevent blood from clotting, so it thins somebody's blood. is what we say thrown clots, or clots. It stops perfusion. Hemostatic is a drug that stops the flow of blood within a vessel. Vasoconstrictor is a drug that's going to cause narrowing of blood vessels, so decreasing blood flow, where a vasodilator is going to open blood vessels, increasing the blood flow. And I think that's it for chapter 8.